How young yung youngest that you've seen in your clinic, yung may vertigo?
Kadalasan ngayon, even 20s, no, meron.
Ito, Doc, anong reason kapag dito sa mga mas mas bata? Yeah.
It's more complex. Actually, even in children, no, medyo mas rare siya. However, mas rare siya compared to middle age. Saka, meron din children. So I get once in a while mga referrals. Pag children naman, so ang balance system natin, I'll explain it in simpler terms then. No? Ang balance system natin is divided into 3. So it's dependent on the eyesight, yung inner ear, and actually yung muscle din sa feet and sa spine. So it also contributes to yung inputs to maintaining the balance of the body.
Yeah, that's why pagka medyo masakit yung paa mo't ika ka medyo, di ba, tinatansya mo yung balanse ng katawan.
Yun. So conditions affecting the eyesight and also yung spine and yung muscles sa feet will also contribute somehow to imbalance and vertigo.
You mentioned about BPPV, no, which is benign paroxysmal positional vertigo, o yung positioning ng katawan versus dun sa ibang klase ng vertigo. So, can you differentiate this one from the other kinds of vertigo?
Yes. So, ang first part niyan is we assess the patient, we talk to the patient, tatanong namin yung history. Ang very special sa vertigo, sa positional vertigo is it's aggravated by head movement, and yung kilo usually mabilis lang, mga 1 to 3 minutes. Tapos sa amin, when we see the patient, so ina-examine namin, so we do maneuvers to differentiate the positional vertigo. Kasi nga positional siya. So we can do different maneuvers. We call it Dix-Halpite to test if it's a true positional vertigo, and some other maneuvers.
I see. And kanina nag-mention kayo ng duration ng vertigo dun sa isang klase. Pero usually, yung more common ones, more common kind of vertigo, ganong katagal ang attack talaga niya? And then how frequent yung attacks?
How frequent? So positional vertigo, so yung isa sa mga common, usually yung acute attack would be short. No?
Which is how short?
Mga 1 to 3 minutes. For Meniere's disease naman, mga 20 minutes. But if you have yung mga labyrinthitis na tinatawag, pagka-infection sa inner ear, and na-affect yung balance system natin, minsan tumatagal na for days. And sa positional vertigo naman, yung acute attack is 3 minutes, but after nun, meron pang residual na vertigo na tinatawag, which could last for hours up to days sometimes in some patients.
I see. Okay, and so it's very important to identify the cause of vertigo.
Yes.
Yeah, kasi dun yun ang magde-determine kung ganong katagal pa siya or magkakaroon ng attack ng vertigo. How about, Doc, stress or anxiety? So, can this parang be a factor para magkaroon ng sensation of vertigo ang isang pasyente?
Not directly, but of course, yung stress and anxiety in general naman nakaka-affect sa well-being ng isang individual. But in terms of direct causality, I don't think it could contribute. It may contribute, but yung direct causality is not that defined. I
see. So, sa mga pasyente nyo, Doc, kunyari, may nagko-complain nga, di ba, ng vertigo. Ano yung dapat bang ginagawa kapag suddenly nakaramdam ka ng sudden dizziness, biglang pagkahilo o yun nga, vertigo? Anong dapat gawin ng pasyente?
Ang number 1 na kailangan gawin is, of course, kailangan mo sabihin dun sa mga kasama mo na kung ano yung nafe-feel mo, and stay calm, kasi pag nagpanik ka, mas lalong mag-worsen yung situation, baka kung ano pa yung mangyari. And ang pinaka-best is either pumunta ng emergency room or makita talaga ng specialista.
Nangyayari ba na ang vertigo parang wala talagang major problems, basically nagkaroon lang siya ng attack? Kasi can it happen that way? But definitely meron problema.
Definitely there is a problem. Ang pinaka-challenge for us ENTs is to identify the exact cause and to rule out yung mga mas delikado na causes of vertigo.
Which can be, yung mga delikado?
Ang number 1 dyan is in the emergency room, ang number 1 dictum or rule among doctors is rule out yung stroke.
Okay.
Yes. So there are signs and symptoms na pertaining to peripheral vertigo, meaning yung vertigo na brought about by the balance system na hindi siya stroke. And meron din namang mga examination findings that are suspicious for central or stroke na tinatawag.
Okay, so kaya talagang dapat, it's necessary na talaga makita ng doktor to check. But definitely, kung kunyari, makita nyo, like say for example, sa emergency room dinala, and nakita naman na parang there's no, how do you say that? Pwede pang magkaroon ng further evaluation and diagnosis, pwede namang hindi i-admit ang pasyente.
Yes, there are instances, especially pag na-rule out natin yung mga life-threatening na conditions, pinapauwi din naman. So with the precautions and we give medications, and also after doing the maneuvers, actually for positional vertigo, ang treatment kadalasan iniisip ng pasyente, it's yung gamot, but it's actually the repositioning. Yung naligaw na crystal, so we do the repositioning in the ER. Kasi it should provide relief already.